I was diagnosed with ovarian cancer April the 13th of 2013. I just got off of a cruise ship. I was feeling it was like, I didn't really know what was going on, but I knew something was going on. I went to my primary doctor, and she suggested we do some ultrasounds and whatnot. So I went and did those. Came back, I had ovarian cyst on my right side. I went to an OBGYN, and she's like, hey, something is going on the left side. And so I was like, well, let's, what is it? Whatever. She's like, she didn't know. And that's when she suggested that I went to see Dr. Schumann. He was new, and that I should go to him because he's an oncologist, gynecologist. So I went to him, I got right in, and he's like, we'll have a surgery. I was in the hospital for 9 days. I got this diagnosis of small cell ovarian cancer. My Dr. Schumann suggested that I go to another facility to make sure the diagnosis, because it is a 1 in a million. So I went, got the second opinion. I got a treatment plan, and small cell ovarian cancer isn't very pretty. So I stopped looking at the internet, stopped looking at whatever, and focused on me, because everybody's different. So I went with the most aggressive treatment plan, and lost my hair, lost all hair on my body. Eyebrows, eyelashes, the whole bit. I chose my port. Most chemo patients have a port. My port was here because all my chemo went straight into the area. When I started my CA 125, which is a cancer marker, that's the reason they knew I had ovarian cancer. It was 1100, and a normal person's is under 35. And so 1100 was definite marker that I had ovarian cancer. And today it's 12, so I'm way below normal. It was just a big inconvenience back in April because I had prom, I had a graduation coming up, I have a daughter going to IU, and all that good stuff. And I made it through. So. I chose Deaconess because Dr. Schumann was just came to the area, and I was in need of a gynecologist, oncologist, and Dr. Schumann was in the Deaconess group. I was looking for close to home because I didn't want to have to travel far away to get treatment that I needed, which with my type of ovarian cancer I do have, I would have had to gone to Vanderbilt or to Indy or away from here, and I wanted to stay local. I love Deaconess. I love Chancellor Center and the Deaconess setup. I had my surgery done at the Women's Hospital, Deaconess Women's Hospital. My Dr. Schumann is at the Chancellor Center. I did my infusion at Deaconess at the Chancellor Center, and now I'm a part of the Chancellor Center. We didn't have to do the expensive travel, and I'm happy with my choice that I could do everything locally. Dr. Schumann and his office, Lisa Helmrich, his nurse practitioner, I could text her anything. We text a lot. Anything I have that I thought was out of the ordinary or with my treatment plan, I text her. She texts me back within a few seconds. I just think the world of them. I think that Dr. Schumann was a godsend to come and treat me. I was like, what better way to be welcome to Evansville to get a rare case of ovarian cancer like myself. And I can't say Mel in his office and Lisa and Ashley, even his receptionist, have all been just wonderful. So it's been it's a good place to be when you're in hard times. The care I received was excellent. I would have not couldn't think of anything else or place I'd want to be. I I still have a really good relationship with my doctors and with my nurses, even though I just go every 6 weeks now. They talk with you. They make sure you're comfortable. They know you by your name. They know your family. They want to know what's going on with your family. So with that is the biggest plus for me, is that everybody's very tight knit, and I wouldn't trade the experience for the world. My family, well, my husband, of course, goes with me, Jeff, but I never had them actually with me at chemo. I always had friends, and it was always a different friend every 3 weeks. So we had a good rotation system going, and it was, so that way it wouldn't all be on my husband or all be on my children. It was a whole family affair. It was a group affair. September the 17th of 2013, I was done with chemo. I was cancer-free, or I am cancer-free right now. I decided to do a maintenance chemo, so I'll always be a patient for at least 2 more years. And so I am currently in number 16 of 32, so I'm halfway there. And just keep monitoring and do my blood work and all that stuff to make sure it stays away, and I'm good to go. So I volunteer because there's, I wanted to, make it less dramatic if you're there to bring cookies or whatever. I talk with a lot of people about ports because I have a port myself. A lot of the ones that is in doing chemo right now, I kind of tell them it's going to be okay. It does get worse before it gets better. I can give back, and I actually know what's going on. I know how they feel. I know the questions they have and the doubts they have. And I love Genesis. It's like I was always a room mother when my kids were small, and I always said it's like being a room mom again, that I have older kids. So, and that's why I bring the goodies and bring some ray of sunshine in the infusion room, because a lot of people think that it's not a positive experience, where for me it was a positive experience. And I don't know, it's just the least I could do for what I've been given. I truly believe that he was sent here for a reason, to come to Evansville from Miami is where he's from. He told me he'd get me through it, and he did, and he got me through it more than he'll ever know, because it is life-changing. It's life-changing in the fact that you never know day to day. You never know what you're gonna feel like one day to the next, and he was very open and honest about that. I could not thank him enough, because he pretty much saved me. How can you put a price on that or a thank you on that?